Hi, this is Dr. Dave Harvey, and today I'm going to talk to you a little bit about our face and neck lift procedures. Essentially, a facelift is an advanced surgical technique that's been around for a long time. The procedure has undergone some renovations over the last few years. It's primarily used to remove excess skin and fullness from the neck and jaw area to give a patient a much more youthful appearance. With respect to the actual procedure, both skin and musculature are tightened. This repositioning of the skin allows for patients to have a more aesthetic jawline. Those who respond best to this procedure have deep cheek folds and loose sagging skin around the neck. In our practice, we make use of smaller incisions which are hidden just in front of and behind the ear folds or the crease just below the chin. Through minimizing our incision lines, our procedures are safer and require less downtime than that seen with traditional face or neck lifts. In this picture, we see the movement of the underneath musculature at an oblique angle. On the left, we see that the incision is hidden in the pre-ear crease and extends behind the ear. On the right, you can see improvement in the jowls and neckline immediately postoperatively and with minimal bruising. Good candidates for this procedure are those with extensive facial and neck laxity, with well-defined bone structure, and those who are in good health and do not smoke. For patients who require less of a procedure, we can modify it to address one or two specific areas. For example, if the concern is just, say, neck fullness, then we may just make a small incision under the chin and perform liposuction or a platysma application. We will tailor our procedures to our patient's interests. Their input is very important to us. Face and neck lift procedures are performed in one of our state-of-the-art surgical suites. We use a combination of tumescent anesthesia, oral sedation, and nitrous oxide gas to optimize patient safety and comfort. This also allows us to control bleeding, thereby making the procedure safer for all involved. The main risks of a face or neck lift are bruising, swelling, skin numbness, mild discomfort, infection, and allergic reactions. Poor healing can be seen in those who smoke or who are diabetic, so this is why we usually don't perform surgery in these patients. One can reduce their surgical risk by closely following our instructions both before and after the procedure. Now, in terms of recovery, you will experience some bruising and a numbness immediately post-operatively. Much of this, thankfully, resolves within a week or two. Sutures either dissolve or they'll be removed in about 1 to 2 weeks period of time. Facial movements can be somewhat stiff for the first few weeks after surgery. It's therefore important to wear your surgical garment as prescribed for 1 week straight and then up to 6 weeks at bedtime. This will help to maximize your cosmetic results, give you increased comfort, and also ensure that a safe outcome is achieved. Now, it's nice to know that lifting procedures can be combined with other procedures. These include CO2 laser resurfacing, microneedling, chemical peeling, and even eyelid surgery. These photos represent some of our before and after pictures. In this first photograph, we see a nice tightening of the neck platysma and skin. One can see minimal neck wrinkles and also an improved lower chin line, which now is more defined and angled. In this second photograph, we see a reduction in both skin laxity and jowling. In this third depiction, we see a combination of CO2 laser with lower left neck lifting, resulting in an improvement for this patient in both skin texture and their cervical mental angle. Finally, in this before and after picture, we see tremendous improvement in necklines and skin contour. Thank you so much for your attention to our video on face and neck lifting. We hope you found this information to be useful. If you have any further questions, feel free to reach out to us by calling us at the number listed or via our Clara app. Thanks again.